Welcome to today's video, where we're going to talk about a critical issue: the banning of puberty blockers for transgender youth in the UK and in Scotland. This topic has been causing a lot of concern, especially around the mental health of young trans people. To really understand the impact of this ban, we're going to need to look at the evidence on puberty blockers, why they're being banned, and what could happen if trans youth don't get access to this essential treatment. In 2020, the UK government launched a review into child gender dysphoria services led by Dr. Hilary Cass. Her findings raised concerns about the use of GnRH analogues, more commonly known as puberty blockers. This led to a pause on the prescription and eventually a full ban for those under 18. Not long after, NHS Scotland followed suit. But this review has faced heavy criticisms. Groups like WPATH, the World Professional Association for Transgender Health, argued that the review was selective and didn't properly assess the evidence. Even Yale University commented that it didn't meet the usual standards for reviewing medical evidence. The British Medical Association, BMA, emphasised that decisions like this should be made by doctors and patients, not via politicians. But I've done a whole video on the Cass review and all the problems with it. So why are puberty blockers so important? For many transgender youth, puberty blockers are a lifeline. They pause the physical changes that come with puberty, giving young people the time to explore their gender identity without feeling the distress of their body changing in ways they don't want. This treatment helps trans youth make informed decisions about their futures. Without it, they risk developing severe mental health issues like depression and anxiety. In places with anti-transgender laws, suicide attempts amongst trans youth have increased by up to 44%. And for those aged 13 to 17, it's even worse, it's up by 72%. These are shocking statistics that should make us all think twice about policies that limit healthcare access to this vulnerable group. So what happens when puberty blockers are banned? Well, the consequences are dire. Without access, trans youth may face irreversible physical changes that cause lifelong distress. Some may well also turn to unsafe alternatives to get the medical care they desperately need. Making healthcare illegal doesn't stop people from wanting it. It just makes it risky and unregulated. There's another inconsistency here. Puberty blockers aren't only used in trans healthcare, they're also used to treat conditions like precocious puberty, yet there are no similar concerns about the safety in those cases. So why the sudden concern when it comes to trans youth? This all suggests that the ban is far more to do about ideology than about patient safety. This ban has plunged many trans youth into a mental health crisis. It's not just about healthcare, it's about rejection and isolation. Research has shown that denying access to puberty blockers exacerbates feelings of hopelessness and isolation, and the most vulnerable members of our society are the ones paying the price. There's also plenty of evidence showing that puberty blockers are both safe and effective. Studies from independent reviews around the world, like the one from New South Wales, confirmed this. They found that even though long-term data is limited, puberty blockers can play a crucial tool for young people grappling with gender dysphoria. So what can we do? We need to push for healthcare policies that provide access to gender-affirming care, not restrict it. We need to write to our MPs, our MSPs and our counsellors, in fact anybody who will listen, and let them know we need healthcare based on evidence and not ideology. The evidence is clear. Puberty blockers can be safe, effective and reversible. By understanding the harmful effects of this ban, we can start to advocate for more compassionate healthcare system, one that truly supports all young people. Thank you for watching. Let's continue to fight for a future where everybody's health and safety and dignity are protected. Together we can create a society that embraces and supports trans youth. If you've enjoyed this video, feel free to like, share, subscribe, comment, whatever, all the things that you normally do with YouTube videos. Thank you.